In today's episode, we do cover some adult themes, so you might not want little ears around.
I have started so many women on cream, and they come back and they're like
high five and you go,
hi, yes! But also like, why has nobody told me this before?
Right, can I just say, I really want to swear, but I don't know if this is a sweary time. Read a book about the your life will change.
The average size of a is 9 to 12 centimetres.
Stop it!
Yes.
What?
Sex is great in the afternoon when you get a bit older.
Fun, fun, fun.
Can I just say that I genuinely don't know what you're going to ask me in?
Welcome to No Appointment Necessary. My name is Healey and I am with a real life doctor.
I know, we are a rarity. I am Dr. Amir Khan. And really, it is hard to get an appointment, so it's great that there's no appointment necessary. And I love what we're talking about today, Cherry. I love it. Ooh la la.
I love that no topic is off the table. And the topic on the table is libido.
Libido, sexual desire. What drives it? Why does it kind of ebb and flow? Is it essential to it? I want to ask you, is libido or sex, let's say, is it essential to a healthy relationship?
I think it's very individual. Personally, for me, massively.
Yeah.
Okay, and this is why I'm just going to give you a rundown. It is really good exercise.
It is.
Your skin looks really great after. I think that when you're scratchy, itchy with each other, you know, you're a bit like, I think it clears the decks.
Yeah.
I think there's something mystical about it where you're kind of annoyed with each other and you have sex and you reconnect and everything feels good again and it's hard to even know why.
I think you're right. It is individual because you can be in a relationship and be intimate without having sex, right? Whether that's intercourse or other types of kind of sexual touch and things. Because I think shared experiences are important. You know, being close physically without having sex, I think you can be intimate that way as well.
It can be kissing, it can be holding. I think it's about being naked together, which is so vulnerable, and you know you can smell each other and feel each other's arms around each other.
Yes.
Actually, sex itself doesn't necessarily mean one particular act, I think.
Yeah, no, I think you're right. But I think my favourite part of a relationship is that first bit, you know, where you can't keep your hands off each other and it's all you can think about and every minute of every day. But then it does change. Your relationship does change after that time. It's not necessarily a bad thing.
I really want to talk today about long-term relationships because I think that, yes, at the beginning it's kind of easy. It does it anyway. You know, you can't keep your hands off each other. You're really excited to see each other. But that does slow down.
It does.
And I think especially with hormones changing for a woman, what goes on in a woman's body that hinders libido? Let's start with that maybe.
Physically, as women get older, particularly around the menopause, then their estrogen, but crucially their testosterone levels drop.
How interesting, because you think of testosterone as a male hormone, but women obviously have testosterone as well.
Yes, they do. And actually, you're right. You know, it is important in men's libido too, but it's equally important in women's. They have a lot less than men, probably between 1/10 or 1/20th of the amount that men have. So it's a lot less, but it does so much. So it affects the brain in terms of driving the reward system, so dopamine and serotonin and all the endorphins. It encourages blood flow towards the genital area, particularly during sex. And so it engorges that area. In the same way, the penis becomes erect during sex. The clitoris also becomes quite engorged during sexual intercourse.
That's so interesting. You wouldn't necessarily know that, but yeah, of course.
Yeah.
Of course. It's all blood flow and everything's feeling hot and aroused.
Totally. And it drives orgasms as well. So it's really important. So during the menopause, when testosterone drops and estrogen, because estrogen contributes to libido in women too, that is why women may feel that their libido kind of dissipates during the perimenopause and menopause, or it can come and go, because the perimenopause is a roller coaster, isn't it? So
it's not linear, it's wild.
Yes, totally.
Right.
Totally. And with men, between the ages of 30 and 40, your testosterone starts to drop about 1% each year. Gosh. So you might feel, it's not the menopause or anything like that, but you might feel your libido dropping.
I think it is actually really challenging for a couple to maintain a really healthy sex life, whatever that means for that couple. But if both of you are experiencing hormone depletion, is it depletion is the right word?
Well, yeah.
Changes.
I guess it is depletion. I guess it is because everything is dropping. Nothing's going up, really. But I guess nothing's going up. I just heard it. But I guess the thing that could be going up is stress, because it's a stressful time of life.
You've got kids, you've got parents that are becoming ill. So
Yeah.
you're often managing kids and school runs or teenagers. So, I mean, it's a special kind of madness that a woman goes through perimenopause while if she has one daughter, is going through teenagedom.
Yes,
I mean, it's like,
of course.
Mother Nature went, hang on, hold my beer. Rolling up the sleeves. This should be fun.
No, but all of that affects the sex life because cortisol blunts sexual desire.
Does it? Does stress stop you feeling
Sexy.
sexy?
Yeah, totally.
Of
Cortisol is a
course.
known blunter of sexual desire.
Right,
So
so
if
you've
you're
got
stressed,
bills, you've got work stress, or not enough work, or not enough work. You've known each other. You're like, oh, Jeff, you didn't put your socks away.
Yeah.
You know, God, the dog's pooed on the spare bed again.
Yes.
Cat's got worms.
all of that. And then there's a triple whammy as well, because around this time is when kind of chronic diseases start to creep in. So diabetes, high blood pressure, all of that affects sexual desire. And medication you might be on also affects it. So it's like a cocktail of things that are trying to work against you having sex.
Fun. So if a woman is feeling like she doesn't want to have sex with her husband, Jeffs, and she knows that she still loves him and wants to have sex, what can she do? Or what could Jeff do?
I think there's a few things. So communication is key. When there's an imbalance of libido, that's when things become a problem, because somebody really wants it and the other person doesn't, and they're not communicating that with each other.
And rejection, and obviously you've got the emotion. It's not just this medical thing, all the emotions between two
Totally.
people of rejection. I think also if a woman doesn't realise that it is hormonal, it doesn't actually mean that she doesn't fancy her partner, her husband. That can be it's very useful to know that might actually just be a hormonal
It's a hormonal thing in a large part. And with the menopause, because of that lack of estrogen, the vagina, the vulva can become very dry and very sore. So sex can become painful as well. But honestly, I would advise most women, if not all, to get some estrogen cream to put down in the vagina vulval area. Because not only does it plump it up and improves the blood flow, reduce risk of urinary tract infections, but it can make sex more comfortable.
Hold the phone. It does so much.
It does so much. And there's
Why are we all not?
That's a very
taking
good question. There'll be just a small number of women who can't have estrogen cream topically around the vagina vulval area. There'll be more women who can't have systemic HRT, so patches, tablets, gels, all of that stuff, for various reasons. But when you put it just down there, it stays down there. It doesn't go anywhere else and doesn't increase your risk of other things that perhaps systemic HRT does, which means you can't have it.
So it's not going to hurt you.
No.
It can help you. And it can do so many different things. Can you get it over the counter?
You can in some places. I don't know if it's UK-wide, but in England, you can get it over the counter. And honestly, I have started so many women on estrogen cream, and they come back and they're just like that.
High five and you go,
Hi, yes! But also like, why has nobody told me this before?
Right. This is why knowledge is power.
Yes.
And I do think during the perimenopause and menopause stage, like how many relationships end unnecessarily because it's corrosive. If you really want to have sex with your partner you really still love, and you get comfort and coziness and pleasure out of it, and they keep saying no, then I think that it has a corrosive effect, like rust in the relationship, and actually you stop feeling like that person wants you. You don't want to really hang out with them. And where can that go? Sometimes it can go to bad places.
Really interestingly, I have seen patients like that, women in particular, who have been to see a different doctor and have been told, rather than this is menopausal, this is hormonal, they've been told it's depression. And so it's a relationship issue, it's psychological, it's depression. And then they get started on antidepressants, which add to that blunting of sexual desires.
How?
Well, it just affects the brain chemicals, and so it numbs you, don't they? Antidepressants don't make you happier, but they help you manage your emotions by blunting a lot of them, including sexual desire. So it gets worse for them.
What should be the first port of call? Obviously, topical estrogen is for the win.
It's for the win.
Hallelujah. Share it with everyone. What about HRT?
So HRT is interesting because it generally replaces the estrogen, and you'll get some progesterone as well to balance out that estrogen. Even though estrogen helps with libido, testosterone is the bigger driver. And on the NHS right now, most people don't get testosterone. And you can, technically, from a specialist on the NHS, if libido is the biggest issue, testosterone from a menopausal gynecological specialist, you can get it that way. Most women have to go privately for testosterone. The issue is the research we have on testosterone in women is minimal. So a lot of private providers are, rightly or wrongly, depending on how you feel about it, are prescribing it off license at doses that we don't know too much about.
Am I right in thinking that there actually isn't a female dose of testosterone available at the moment? There's only male testosterone. Can I just say, I really want to swear, but I don't know if this is a sweary time, but I just think that is shocking that in this day and age, we're not doing, that's not up to date. There should be a female dose for testosterone, considering how many women struggle with lack of libido.
Yeah.
And like you say, it's not just sex, it's drive, it's, ambition, it has other impacts.
It has, fatigue, tiredness, all that weakness, all can be attributed to lower testosterone.
Why is there not an appropriate dose for women in this day and age?
I think you know the answer to this, Cherry, because historically women haven't been researched in the same way that men does.
Right.
On the flip side of this, men are being sold testosterone left, right, and centre for allegedly low testosterone levels and gummies and things from influencers and wellness people when they don't need it. If you haven't got a testosterone deficiency, if you haven't had your testosterone levels checked and they're not deficient, you do not need testosterone.
Will it do damage to a woman or a man if they take it and they don't need it?
It certainly can, yeah. So with men, so testosterone is made in the testicles, but it is stimulated by your brain. So you've got hormones in your brain, LH and FSH, that will go down to the testes and say, right, start making testosterone, because we need to balance out levels. If you're taking supplements and your blood levels of testosterone are high, your brain will think, I don't need to stimulate the testicles to make testosterone because we've got plenty floating around, and your testes will stop making it. They can shrink as a result, and your sperm count can drop as well.
Oh, gosh.
Yeah, so all these men are going, I'm manly, I am making more sperm because I'm taking these gummies. No, you're not.
What are they going?
This is the walk.
Where are they going?
This is the walk.
Carrying really light, heavy bags.
Yes.
So taking it can be damaging for a man because it stops your natural function, your natural mechanics.
Yeah.
That is such an
Makes you aggressive, gives you acne, all of that stuff. Yes, it grows your muscles too, but
there it is again.
But is it worth it? No.
Question: does it harm a woman to take it if she doesn't need it?
It can do, yeah, because it can grow facial hair, affect your muscles, affect your heart, all of these things as well. So it's really important. The British Menopause Society are really clear when it comes to testosterone that it must be given by someone who's got a specialist interest in kind of the menopause, but also we've got to be very careful with doses, and it's only licensed for libido. I'm not passing any judgment because we the research is just not there who are giving it as part of regular HRT. Some women feel great on it, others don't.
So would your advice be for a woman to, if you really feel like this is an issue and you really do want testosterone, go to a specialist gynecologist who understands the dose to be giving it and can give you the right advice?
If you've been prescribed testosterone as a woman, you should have been explained of the side effects. You should have been told all of those things. But the most common things are what we call hirsutism, facial hair in the male. Hirsutism.
Hirsutism.
Yes. And it's kind of a beard and a moustache, really. Kind of hair around that.
Nobody wants that. No. Do you know what? I have to wear a lot of PPE for factories because obviously I'm at that show in South London.
Yes.
And all the boys have to wear beard snoods, and I'm always joking about how I don't have to wear one. But if I was taking testosterone, I might have to wear a beard snood in a factory.
Well, it may not be that intense.
I could grow a moustache. We could have like a tash off.
That's true. Movember is coming.
Is it worth for a woman when she's feeling hormonally balanced, whatever that feels like? Is it worth going to get a test and getting a snapshot of what your hormones look like. Is that a thing?
It is and it isn't. So if you think you're perimenopausal, then we do a blood test on you to check your hormone levels, but only if you're 45 or below, because that is relatively early to go through the menopause. If you're above 45 and the symptoms match the menopause, having your bloods taken won't really tell as much because, as you know, the blood hormone levels will be up and down, and it just depends on when we catch them. And actually, your symptoms are a much more accurate way of diagnosing the menopause.
But if I was 38, I wasn't perimenopausal, is it worth going to get a blood test so I can then bring it to you and say, my normal is this? Or because women are so cyclical, that's just not going to tell you anything.
No.
It's like reading one page of a book.
Exactly. Everything goes up and down. And so it's really hard. It's the combination. If you've got no symptoms, I would say there is no point getting hormone levels checked because you're going to catch, it's just a snapshot of that day in that moment.
It's not going to help you later on.
It won't help you later on.
Fine.
We're better off combining blood tests and symptoms.
Right. What are the reasons for painful sex?
So we call it dyspareunia. That's the medical term for painful sex. And there's lots of different reasons. An infection is a common cause. So a sexually transmitted infection can cause pain during sex. The menopause, of course, because lower estrogen, drier vagina, vulval area causes a lot of friction. But also gynecological issues like endometriosis, adenomyosis, fibroids, pelvic inflammatory disease. All of these can contribute to painful sex. So if you are having sex, it shouldn't be painful. First of all, women, it shouldn't be painful. And if it is, you need to come and see one of us, GPs, and we will investigate the cause of it.
Endometriosis is where the lining of the womb grows in places it should not be.
Yes, tissue similar to the lining of the womb.
Right.
Yeah.
What is adenomyosis?
So that's where tissue similar to the womb is found in different layers of the uterus itself. So where it shouldn't be, but within the uterus.
What are fibroids?
Fibroids are kind of knotty muscles within the uterus as well. And all of these things respond to hormones. So they cause pain and bleeding, particularly around your period, not exclusively. But with endometriosis, that tissue similar to your womb can be anywhere in your body. You know, typically it's normally confined to the pelvis, but not always. It can go as far as your skin. It can go to your liver. So it's really awful. Adenomyosis is like endometriosis is ugly sister, and so it like lives within the womb.
Do any of the gynecological cancers cause painful sex?
They can do, yes. Most gynecological cancers don't cause pain as a symptom unless they're very advanced and growing and pressing on things. But endometrial cancer, cervical cancer can cause painful sex in the advanced stages, but it's not a common symptom to begin with.
If you are experiencing painful sex, do not put up with it. Go and
get checked.
Sex should be really lush.
Yes.
And feel really happy and good and safe and loving.
Totally.
What about bleeding after sex? What causes that?
So if you have got bleeding after sex, you must go and see either your GP or a sexual health clinic who will do swabs and check it out and treat it. If it's negative and you still have bleeding after sex, particularly, so we call it unexplained postcoital bleeding, generally for 4 to 6 weeks or more. So we've ruled everything out. We need to think about cancer in those cases. So cervical cancer being the most common one. And the one cancer we never talk about really is vulval cancer. Lots of women don't know you can get cancer of the vulva. Vulva is the whole outside part of the female genital tract. You can get cancer there. Any changes on the vulva, whether it's an ulcer, a red spot, a white spot, a black spot, anything, get it checked.
And the sooner the better, because actually I know what it feels like. You know, when you feel something's not quite right and you go, oh God, and it's really easy to just ignore it, but it keeps you awake at night and you think, I really hope that goes. The sooner you go to the doctor, the easier it will be.
Totally. And I can't tell you,
counts.
Cherry, you know, I've had a handful of women in my career as a GP who knew they had something on their vulva and they just didn't come, and they got treated for thrush or other things, and they just didn't come and get it looked at, and that's really sad. Now, Cherry, I've got a question for you, because obviously as a man you hear all the time size matters when it comes to sex, and there is this kind of pressure put on men, I suppose, about having the right size or a big size.
Right.
What's the real story?
Okay, I'm going to lay it down.
Be honest, please.
Every woman is different, which is a really boring answer, but size doesn't matter.
Really?
It's what moves you got.
Not even like girth.
It's what moves you got.
Okay.
I think it's knowing a woman's body. It's really worth having a little Google of where the clitoris is. And I think also, if you've done a bit of research, if you've read a book, if you've spoken to your friends, really sets you apart from the others. But I do think that not a lot of men know the geography. And I find it extraordinary that they'll know who's been transferred to Aston Villa next season and how much that is going to be. And they know that Liverpool, in 1989, that player was there. And I'm like, read a book about the clitoris. Yes. Your life will change. I think, do your homework. Know where it is. It's different on every woman. It's like a little pea. It feels like a little pea. You'll know when you're feeling it, and if you're not feeling it, that's because you're not feeling it.
Yeah.
Don't be rubbing the left side of the
thigh.
labia. I mean,
no. Let's talk about the clitoris, because I think it is fascinating. Like, fascinating.
Because what is it?
Okay.
What is the clitoris?
Well, the bit that you can see and feel, that pea that you mentioned there, or the button, is about, on average...
I hate both words, but the pea,
the button.
The pea and the button.
Well, it's like the tip of an iceberg, because the
Yes.
clitoris is huge. So lots of people think it's just the bit you can see and feel.
The pea.
Like the pea, 4 to 7 millimetres.
Right.
But the clitoris goes well inside.
It's like a monster.
It's like a monster. It has got legs called crura, 2 legs. And the average size...
want mine to have legs.
It has little branches. The average size of a clitoris is 9 to 12 centimetres.
Stop it.
Yes.
What?
Yes.
Like way bigger than most men's penises.
Speak for yourself. No, but it's also got 8,000 nerve endings.
Yes, it does.
Yes.
I want to know, I'd love to be a man for like half an hour. I would love to know whether a man's orgasm or a woman's orgasm is better, because a woman's orgasm might not happen as often, but when it happens, I mean, hold the phone.
Yeah. And you guys can keep going.
It can last ages. Like, don't be stopping, Jeff. Like, it can go on and on and on.
How long are we talking?
And it can change. I mean, definitely 30 seconds.
Wow.
Sometimes.
Yeah.
And sometimes it changes flavour.
Okay.
As it progresses.
Yeah,
so, like,
yeah.
I just think it's very different from a man's ejaculation, which is just like, done.
Yeah.
There we go.
Roll over.
Right, I'm off.
Yeah.
A woman's, and also a woman it can happen again very soon after.
Yeah.
Or just leave me alone.
Well, during a climax, you get a sudden rush of all those brain neurotransmitters, oxytocin and dopamine, endorphins, all of them.
All of them.
Huge. And then you get a massive rush of blood flow to the genital area, and simultaneously you're getting all these, like, constant muscle contractions, which is why you're like, oh.
It's extraordinary.
Yeah,
It's such a
yeah.
magical. I don't think it's such a magical, wild thing.
I'm going to tell you some statistics I looked up before coming in today. So this is with heterosexual couples. So on average, I looked at 3 different studies and I'm averaging the results. On average, during sexual intercourse, men will have about between 85 and 95% of men will orgasm. And when women answer the same questions, it's 45 to 65%.
I bet.
But only 18% of women said they orgasm from intercourse alone.
Oh, 100%. Oh, 100%.
How do we get that 18% up, Cherry?
I think toys in the bedroom, bring them in, and I think bring them in early in a relationship if you can, or just... I think it's rare that a man will be like, no, I don't want to do. Do it sensitively, because I think it can be quite intimidating in some ways. But I think use lubricant.
Yeah.
For a woman, that's wonderful. And also, don't be afraid to like pleasure yourself while you're having sex. I think talk to your partner. Men, talk to women. Am I doing this right? Is this what you like? Be curious. About sex. When we play tennis, we go and get lessons, but we don't learn about sex. You can get better at sex.
Yeah.
You can get really good at sex, but you have to be willing to learn and ask questions. Go and look at YouTube. I mean, literally, that you can see, clear your browse history if you're at work, obviously. But if you want, you can get really good at sex.
Purely educational YouTube videos.
Educational YouTube. Yeah. But it's all there, all the information. I mean, there are wonderful high street shops and Summers. It's so that the women in there are so educational about the different toys and everything. You can really have, and you feel like you want to die inside when you have that conversation. You're like, oh, I'm not a pervert. But times have changed.
Totally.
Times have changed.
Yeah.
You go in there and they will just go, oh, this one is this if you like this. And it's like you're buying a kettle or something.
The different models.
They're not embarrassed. They couldn't be less embarrassed. It's like buying croissant at a bakery. Yeah. Go and just ask questions.
I love it, because there'll be couples or women or men listening to this whose libido has been low for some time and perhaps not there from a relationship point of view.
Yes.
So perhaps they could go into these shops together. They'd have to talk beforehand, talk about what they want to get out of it, go into the shops together and get those kind of toys.
I think it's a really fun thing to do, because it's kind of, for most people, it's a very wild and very exciting and then go out for dinner and laugh like crazy about it. Are there any underlying health conditions that can affect your libido?
If you have got erectile problems, so you have difficulty maintaining an erection or getting an erection, that is type 2 diabetes until proven otherwise, or heart disease until proven otherwise. Because remember, to get an erection, you need good blood flow to the penis. And for good blood flow, you need healthy blood vessels. And if your tiny blood vessels in your penis are clogged up with either fat or have been damaged from high blood sugars, that affects erections. Once I'm confident they haven't got type 2 diabetes or heart disease, I can start them on medication. And we can give them Viagra.
Is it completely safe for a man to take erectile dysfunction medication without the help of GPs?
It depends on what other medication they're on.
Right.
So the way Viagra works, or these erectile drugs work, is by widening the blood vessels and improving blood flow to that area. If you're already on drugs, perhaps for heart disease or high blood pressure, that widen the blood vessels anyway, because that's how we lower blood pressure, it can cause too much widening, your blood pressure drops too low, and you could collapse.
I've been told quite recently that men take it sometimes just recreationally.
Yeah. If you're dependent on these drugs to get an erection, you also do need the stimulus, the desire as well. The drugs don't work without the stimulus.
So if you took one and went to watch a really sad film,
you're not going to sit there with a hard on.
Massive erection.
No.
Let's talk about alcohol and sex.
Yes.
Because I think it's one of those funny things where you think it's going to help because you're all a bit like loosey-goosey, wee.
Yep.
And actually, I think the best sex is when no one's had anything to drink. My favourite time to have sex is in the afternoon.
Oh, yeah, daytime.
It's wonderful. Daytime sex is like luxury sex.
Yeah,
it's so good.
Well, you're absolutely right. So people think that alcohol will help because it causes some, disinhibition, doesn't
Everyone's good looking.
Yeah. But actually, it blunts sex drive and libido. So even though you might give you the confidence to go and chat up someone, when it comes to the making love part, you may not perform in the same way.
So I call sex in the afternoons a luxury afternoon.
Nice.
There is nothing more exciting in the busy world. Getting into bed in the afternoon and having a really good old cuddle. No one's had anything to drink. No one's tired from doing the laundry. You're fresh. You've got energy. It's the best time to have sex.
Your energy levels as someone slightly older, perhaps even my age, they peak around that time. In the evening, you're knackered. You're tired. It's not like your 20s. And you want to sleep.
Yeah.
But in the afternoon, that bed is there for sex, right? So the combination of the environment and your energy levels mean that sex is great in the afternoon when you get a bit older.
This subject is so huge, I feel like we should do it again. We haven't even touched on porn.
Yeah, let's do a part 2, I think, in the future.
But it is, in fact, time for Chat GP. And we're going to keep it on topic. The questions today are on sex.
Can I just say that I genuinely don't know what you're going to ask me here. Genuinely have no idea.
It's so exciting.
It feels like actual general practice. I don't know what's coming through the door.
Helen says, my little girl is 1 and I feel like I never want to have sex again. again! Exclamation mark. To be honest, after my husband saw the birth, I'm not sure he does either. Will I ever get over this? I think a lot of women can relate to this.
So common after childbirth because your genital area has been through a huge trauma. It may have been a difficult birth for Helen. They may have been episiotomy. They may have been instruments used. All of that could be contributing to why she might not want to have sex now. And a year is a long time. If they haven't had sex for a year in a relationship that might have had a lot of sex before, that can feel very difficult for the man and the woman. And again, we've got to go back to what is the issue. Is it lubrication? Is it pain? Or is it psychological? In which case that communication and gentle steps forward are key. So speak to your husband, Helen, or partner. Talk about other ways that he may be able to pleasure you and you him that don't involve intercourse to begin with. And then gently move forward to intercourse if that still feels right. But if there are any anatomical issues that haven't corrected themselves after birth, an episiotomy, for example, then that hasn't healed properly, see a doctor.
I personally think that those kind of really intimate chats are good when you're cuddled up in bed together.
Yeah.
And it's not accusatory. It's, hey, I'm struggling with this. Can we together find a solution?
Totally.
Like be my comrade in this. Melanie asks, is there a female Viagra?
Not really.
Of course there isn't, Mel. Of course there isn't.
So we've talked about testosterone being used in libido issues already in women after the menopause. That is as close as we've got really right now. But there is research going on around libido in women. Even though we haven't got it yet, I imagine in the next 5 to 10 years, which I know is a long time, there will probably be more research and more evidence-based medication we can use for women with low libido.
I mean, whoever invents that's going to be a gazillionaire.
Yeah,
because
why
the irony is that more women, I would say, is this true? More women struggle with low libido than men because of changing hormones, classically.
Makes sense.
The fact there's 5 different Viagras for men and none for women, someone hasn't done the maths.
No.
What am I doing here? I need to go and invent something. So if you Google female Viagra, there's a thing you can get, I think it's from America, called the pink pussycat pill.
I don't know exactly what the pink pussycat pill is, but there are lots of people who are advising herbal treatments for low libido. Ginseng is a common one. And again, we don't have the large randomized control standard trials that say these definitely work. So you've got to do some research around, is it going to affect any of the medication you might already be on? Might it be harmful to you? Most herbal things are not harmful in small doses, but that's a blanket statement and it doesn't apply to each individual.
I mean, yeah.
Right, that's enough now, Cherry. I think we need to move on. Let's do the health hack of the week. And normally I do this, but I feel like today you are the expert on this topic. So what is your health hack of the week?
If you're really struggling with sex in a relationship and it's timing and you're too tired in the evening, you don't feel like it in the morning, my health hack tip is a luxury afternoon. If you're struggling to get into sync as a couple, try sex in the afternoon. Maybe book an afternoon off. Maybe go to a hotel at the weekend and have sex in the afternoon. It's the best.
It's the best. I am going to start advising my patients on luxury afternoons.
Well, that's all we've got time for on this episode of No Appointment Necessary. But we would obviously love to hear from you. So you can WhatsApp us, you can email us. All of the details are in the show notes. And don't forget to follow us and subscribe wherever you get your podcasts. Apple Podcasts, Spotify, and also you can subscribe to our YouTube channel.
See you next week. And don't forget, no appointment necessary.